Welcome to week 35. 1 month to go. Can you believe the baby is almost here? At 35 weeks, your baby's about 5.5 pounds, about 19 inches long. Again, continues to grow at a pretty healthy, rapid pace. Your baby at 35 weeks is strong, it's good. Still would like to keep the baby in a while, but your baby is going to be healthy even if it's born at this point. And even some 35-week babies, if they're born at 35 weeks, are able to go home with mom and not have a NICU stay, although it is still possible and maybe likely that if the baby were to be born at 35 weeks, it would have to stay in the hospital for a little while. At 35 or 36 weeks, there's a test called Group B strep test that your doctor is going to want to do. It's traditionally done at about the 35-week appointment, and basically what it is a Q-tip that's put in the vagina and then to the rectum, and it's sent for culture. And there's a bacteria called Group B strep that we're looking for to see if you're a carrier of that. Group B strep is not a disease, it's not even really an infection. We all have bacteria on our skin of different types. Group B strep is one of the types of bacteria that people have normally on their skin. The problem is it can make newborn babies sick. So if we find that you have Group B strep, we give you antibiotics when you're in labor so that the baby doesn't pick it up as it comes through the birth canal. So that's what the Group B strep is about. Often the doctor, when he does the Group B strep, will also check your cervix, see if you're starting to dilate a little bit, and make sure the baby's head is down. At 35 weeks, we really like to see the baby in vertex presentation or head down presentation. If the baby is not, then we'll probably confirm that with an ultrasound, and then we'll talk to you about what we would do if the baby stays in a position other than vertex. Really, options would be a C-section or something called a version, where we try and turn the baby to get it into a head-down position. So 35 weeks is sort of when we want to establish that, usually when we do the Group B strep test. You might also notice at 35 weeks that the movements continue to change. You have less of those rapid kicking movements. It sort of slows down a little bit, more of the moving, rocking movements. This is when, if you're not sure if the baby's moving well, you can do a kick count test where you lay down and make sure that you're feeling the baby kick, or at least some movement, at least 10 times in 2 hours. That's a good reassurance that the baby's doing well. 35 weeks, you're almost home. You got a month to go before you'll be holding this baby in your arms. And the baby is big. It's 5.5 pounds and likely head down and ready to head for home.